Hey, everybody. Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director of the Institute for Healthcare Consumerism, along with my CEO and founder of the Institute for Healthcare Consumerism, Doug Field. And actually want to welcome Adam Berry onto the program with American Health Value. Adam, welcome to the program.
How are you this morning?
Hey, good. Now, I know you guys have been in the HSA space for a long time. Kind of talk to us a little bit about American Health Value and what you guys do.
All right. Well, we are a privately held national independent HSA administrator, and we are based out of Boise, Idaho, and we were founded in 1996. Mm-hmm. And we have accounts in 49 of the 50 states, and we work with agents and carriers nationwide to open health savings accounts for individuals and groups of almost any size.
Hey, Adam, this is Doug. By the way, say hi to Michael when you see him, please.
I will certainly do that.
Sorry you couldn't join us. Hey, you're doing some really unique things with Idaho and the Idaho MSA program. Talk to us about that.
Well, the Idaho MSA program is actually pretty unique. Idaho is actually one of only 3 states that has a medical savings account program that is not considered an Archer MSA. Mm-hmm. As we all know, those were extinct with the implementation of the health savings account. So Montana and Utah are the only other 2 states that have an actual MSA, just a state MSA. But recently, Idaho has kind of paved the way a little bit because they increased the contribution limits to $10,000 and $20,000 annually in March of this year. So basically, people who are residents of the state of Idaho are eligible to open this medical savings account. It's tied to their tax filing status, and so if you file an individual return, you can contribute up to $10,000. If you file a joint return, you can contribute up to $20,000, and that money can be used to pay your health insurance premiums or any eligible medical expense defined by the IRS document 502, similar to the HSA. But basically, that money reduces your taxable income on the state level dollar for dollar as well.
Adam, in case some of our audience doesn't know, tell us the difference between an HSA and an MSA.
Well, the HSA is a federal program, right, as we all know, and so it's tied to a high deductible insurance policy. Right. So obviously you have to have the qualified HDHP in order to open your health savings account. The Idaho State MSA is just a state program, and it's completely agnostic of any insurance policy. So whether you have a PPO or a high deductible policy or you're on Medicare or you're uninsured, it's completely irrelevant. As long as you're a state resident, you are eligible to open this medical savings account and fund it based on your tax filing status to reduce your taxable income and pay for eligible medical expenses like health insurance premiums with tax-free dollars.
Yeah, thanks for outlining that, and I think that's where a lot of us in this space would like to see this thing, see it go. Not be connected to high deductible. Give the consumer a lot more freedom of choice, a lot more freedom to put money in there and use it for medical expenses. Are you looking at other states with this?
We could potentially expand this to other states. I think we really wanted to start with our home state here. That's why we partnered with Idaho Independent Bank. They're a local Idaho bank, and as we're based out of Boise, it's our only location. We really wanted to have a bank that we could, have access to, people have access to in different parts of the state. And so once we get everything kind of nailed down in Idaho, I think that we would look at expanding this into different states, particularly Montana and Utah down the road.
When did this roll out, Adam? What was the timeline for this?
Well, the state MSA has actually been on the books for quite a while, since the late 90s. Okay. But for some reason in Idaho, I'm not sure, I can't speak to Utah and Montana, but I know that in Idaho, from living here, the education level to the general public, but also to insurance professionals, CPAs, people in those industries that deal with people's taxes and their health care, the education was fairly low. Nobody is aware of this program. There were less than 5,000 in the state. And so we partnered with the bank on the 1st of January of this year, and then the contribution limits actually were changed by Idaho State House Bill 595 on the 28th of March of this year. So we ended up launching this program with the bank in mid-May. And so we're in the middle of just kind of an educational push through insurance professionals, CPAs, financial planners, and then, of course, Consumer Direct as well, to just try to educate as many Idahoans as we can and get the word out about this program.
Adam, when you kind of look at the healthcare space right now, and we talk about it all the time, you've got the emergence of private exchanges out there in the marketplace. You've got the benefit plan designs moving more towards, the higher deductible type plans, but also the full replacement high deductible plans where that's really the only plan option. Where do you see health savings accounts, moving in the future given some of these dynamics that are in play?
Right. Well, the market is certainly ever changing. I wouldn't say it's unstable, but it's definitely something that's fluctuating. And as an HSA administrator, we obviously have been keeping a very close watch on this for quite some time. But with the HSA making its way into the federal exchanges, and obviously there'll be in the private exchanges that are popping up, there's going to be plenty of HSA qualified plans as well from different carriers, and so the HSA is alive and well. I think it's flourishing. I think the numbers show that the HSA has continued to grow exponentially throughout the nation. And I think as more employers become comfortable with the HDHP HSA option, at least for their employees, and offering at least that dual option, I think that the HSA is just going to continue to flourish here.
Now, when you're talking with your clients, whether it's an employer out there, whether it's a broker advisor, what are the 1, 2, 3 things that you really talk to them about, regarding the HSA, and do you talk to them about some of the other pieces that marry well with that health savings account when you're looking at plan design?
We do a little bit. I mean, we don't sell insurance particularly, and so by the time we work with these people, they've got their insurance structure in place, and it's obviously a qualified high deductible plan. And so a lot of what we do with our clients is make sure that they have the education they need. I think that's a huge gap in the industry right now. I think even people who have health savings accounts typically don't understand them. And I know a lot of people in the general public, you start throwing these quote acronym accounts at them, HSAs, FSAs, HRAs, but you see just people's eyes kind of glaze over. And so that's a big thing that we really try to focus on with our clients, is really educating them from an employer level, an HR level, but also an employee level, and make sure that all the employees that receive these, especially in a dual option scenario where you're going to ask them to choose, would you like this PPO as a copay, or, do you want to go with this HSA solution? You really need to help them understand that benefit they're getting, especially if there's an employer contribution involved. They could potentially be leaving a lot of money on the table. And so that's really where our focus is trying to educate our clients and our potential clients as to the value in a health savings account, a high deductible policy for their employees.
Adam, that makes a lot of sense. Is there a typical size of customer for you, an employer size customer?
There is not a typical size, no. We have we work with individuals, definitely, and we work with groups of any size, small employers, mom and pop shops, and then we also have a couple much larger clients. So we really tailor our health savings account to the needs of the client, whether that's the individual or the group, and depending on the size of the group. I mean, like I said, our major focus is education. So we really try to make sure everyone understands the benefits, and so we'll come out and do in-person presentations and seminars and things like that for the employees, and it doesn't matter what the size of the group is. We'll make every effort to make sure everyone understands what they're getting.
Okay. And when you're looking at when you're doing these presentations, is there some typical questions that come up from the employee population about the accounts?
Yeah, the use it or lose it is a big one. People continue to, I think they're a little bit more comfortable, or they've heard more about people's FSAs in the past, and so having to pick how much they put in at the start of the year is one typical question. If I don't spend this, do I lose the money is another one. There's a lot of questions. Obviously, if there is an employer contribution involved, then we really try to make sure people understand that that's money that you're keeping in your pocket if you don't choose to spend that money, as opposed to a different type of a setup like a PPO plan where you're essentially just paying money into premiums that you may or may not use with the copay. So that's a big one for us. Eligible expenses is always a fun one. People ask a lot of different interesting questions as far as what expenses are eligible and which ones aren't. And Obviously, the rough answer is having to tell people they are no longer eligible to purchase over-the-counter medicines and things of that nature, but I would say those are pretty common questions.
Now, with going back to the Idaho MSA for a second, are you going to have any benchmark numbers coming out anytime soon? I know that it's still in the works, and you're going to have any numbers coming out maybe sometime next year around this?
Yeah, I would say around this time next year we would have a great idea of kind of how this program is going to work with Idahoans.
Great. Would love to
now. I'm sorry?
No, would love to see those when you guys do have them, definitely.
Absolutely.
We got about a minute or two left, and just want to let the audience know how they can contact you guys and one or two good takeaways.
Okay. Well, we have a website. It's IdahoMSA.com, and the phone number here nationally, I guess, is 800-914-3248. And so you can visit that website, and that's a great resource for anyone looking to get more information on the program or to apply. You can do basically anything that you would need to do on that website. So that's probably the best resource at this point.
All right, Adam, thank you so much for joining us on the program today. Everyone else, again, the Super Saver rate for our conference is $99 up through the second week in September. And for everyone who wants access to privatehealthcareexchange.com, we do have the special promotion. In the promotion list, actually type in IHC Radio, and you'll get discounts on privatehealthcareexchange.com. Adam, again, thank you so much for joining us on the program. And to everybody else, have a great weekend, and we'll see you next week.
Thank you so much.